Good evening, everyone. My name is Brian Wolf. I'm the chair of pathology and laboratory medicine who followed Lucy Rorke, as you'll find out. And I'm pleased to welcome everyone today to this incredible event to celebrate Lucy. We have a pretty extensive program, which you can follow on the little place card here. And I'm actually not allowed to speak, but since I'm emceeing it, I'm going to take the liberty of saying a few words about Lucy, especially about her early childhood and what brought her to Philadelphia. So we're very fortunate. There's an autobiography that Lucy published in 2008, and it starts with, I was the fifth and last daughter of Armenian immigrants and was born in St. Paul, Minnesota, the year my father lost his job and the country was plunged into depression. She then talks about her childhood, and she clearly had a very loving and culturally stimulating home environment. But when she entered kindergarten, she could not speak English. And so she sat on the swing in the doorway between the classroom and cloakroom and cried. Can you imagine Lucy, 5 years old, crying? But she had a wonderful teacher, Miss Strickland, who helped her, obviously, to realize that she had to speak English. Then she talks about her early childhood, and I don't know if she was a bit of a tomboy, but in the description, she had a number of accidents. Broken leg, facial laceration, from a sled crash into a tree, near drowning, and so on. Now, she didn't say what the so on was, but I shuddered. So she wasn't allowed to do any sports except walking and running, which were deemed safe. And she lived in a rather rural area outside St. Paul. And as she pointed out, in those days, we walked 3 miles to grade school, 3 miles, and 5 miles to high school. The morn of school buses had not yet dawned. And she remembers walking through the snow, through 6 to 10 inch paths of snow. So imagine Lucy walking through these snow drifts to get to school. She eventually grew up. I'm just going through some of this. And then she talks about her career, her desires. And when she was 18, her dream was to become an opera singer. And as you know, Lucy is an avid opera fan. But what happened in those teen years was she was going to go to an audition with one of the Met stars. And unfortunately, that Met star fell sick, so the audition was canceled. And Lucy, as she pointed out, in the dramatic manner of teenagers, I was so devastated that she couldn't audition to be an opera singer that I lost interest in pursuing a career in music, and my focus turned to medicine. So medicine was a default choice for her. It's turned out very well for medicine, I must say. She entered the University of Minnesota in 1947 and stayed there for 10 years, getting her education, her Bachelor of Science in Medicine, and her doctoral degree in 1957. She talks a bit about her class, and actually very interesting. This is the 50s, only 5 women in a class of 110, all of them quite different. She talks about her neuroanatomist, and she said he was a most uninspiring lecturer, and I had great difficulty in grasping the subject, for which I was given a grade of D on the mid-quarter exam, which is somewhat ironic for someone who's went into neuropathology. And I feel completely with you, because I also had a failing grade in neuroanatomy when I went to school. I hated neuroanatomy. The professor could draw with both hands, you know, the cuts through the brain. Anyhow, so I'm not a neuropathologist. Then she went she was interested in actually becoming a surgeon, and she really wanted to become a neurosurgeon, and so she spoke with the chief of neurosurgery at the time, and as she pointed out, he listened politely as I outlined my dream to become a neurosurgeon and request for advice. When she was finished explaining why she wanted to be a neurosurgeon, he leaned back in his large chair, and with a wry smile, he informed me that should I pursue such a course, I would starve. Because in his view, neurosurgery was basically a referral type of specialty, and no one would refer a case to a woman. So this, you know, this is the 50s. And Lucy, as you know, has a lot of spunk. So then, this is still in med school. She talks about match day. Match day is when you find out, when you're finishing med school, where do you go for residency, for training. And she vividly remembers the day and the contents of the envelope, which she opened in March 1957, informed her that she had been matched with Philadelphia General Hospital. PGH used to be right across the street from where we stand. And so that's her journey from St. Paul to Philadelphia. And I'm going to stop here because you're going to hear a lot of other memories from her time in Philadelphia. And so I'd like to call up first Chad Huff to share some memories.
Thank you, Brian. I'd first like to say to you, so I'm Chad Huff. I'm the Senior Vice President of Clinical Support Services at Children's Hospital of Philadelphia. And I'd like to first say to Lucy, it's an honor to have been asked to make remarks at this amazing celebration of your amazing 50-year career at CHOP. You're a remarkable person, one of the most amazing individuals I've ever known. Not only is Lucy an international known clinician and educator, but one of the most interesting and interested people I know. To this day, every time I run into Lucy, she asks about me personally, about my parents, and about how I'm doing, and I really, really appreciate that. I got to know Lucy really well when we began working together in 1995. It was at that time that Cam Witzleben, who was the chair of the Pathology Lab Medicine Department, retired, and Ed Nodebart, CEO extraordinaire, who's here today at the time, asked Lucy if she would serve as the interim chair until a new chair was selected and on board. And Lucy, being the gracious, wonderful person, she obviously said, of course I will do that. It was a logical choice because Lucy had great institutional and departmental knowledge, and she had served as the president of medical staff and was highly admired by both administrative and medical leadership. However, what Ed did not tell Lucy nor me was that this interim assignment would extend for 5.5 years. However, I consider the length of time that Lucy was in the role to be a credit to the job that she did. She advanced the academic and clinical missions of the department through improved inter- and intra-departmental communications, recruited new faculty, successfully managed some difficult personnel changes, remember those, Lucy? Expanded the menu of clinical tests, increased revenue significantly, and established what is today a very important part of the program, a pathology medicine program, the Chairs Fund, which provides monies to the chair to advance clinical and academic missions. The only one unfortunate experience I had during the time I worked with Lucy. So I was in my office one day, and I got a call from Lucy's assistant that said Lucy wanted to meet with me right away. So of course, being the dutiful administrator that I am, I ran over to her office, and I was told by her secretary, she's in the autopsy room. Like, okay, she's in the autopsy room. I went into the autopsy room, and there Lucy was doing a brain autopsy on a baby, and she said, come over, I need to talk to you. So we had our meeting in the autopsy room, and it was at that time that I said, wow, this woman is really, really amazing. And now I know what she really does. In preparing for this evening's remarks, I came across a letter that Lucy wrote to Ed Nodebart in 1997, a few years into her interim role, in which she summarized her accomplishments and was clearly a salary negotiations letter, but she stated at the end of her letter, I have attempted to incorporate the enormous responsibility of the chief's position with pre-existing demands as neuropathologist with some measure of grace and hope that when I cover my microscope and walk away from CHOP, it may be said of me that she remained amused, serene, and whole. Lucy, I thank you for everything you taught me, for everything you've done for CHOP, for patients and families of the organization, for neuropathology nationally and internationally. I thank you for introducing me to opera, it's a theme, and the wonderful dinner at the Waldorf Astoria in New York that one night, the Christmas soccer torts, thank you, and most importantly for your friendship. You're a kind, elegant, and amazing person, and most importantly, I will miss you tremendously in the hallways of CHOP. I wish you all the best, happiness, love, Chad.
Thank you very much, Chad. Bob Domes, please.
Well, good evening, everybody, and thank you for joining us for this celebration. I'm Bob Domes. I'm currently the pathologist in chief of our Department of Pathology and Lab Medicine based at CHOP. We have at least 4 or 5 pathologists in chiefs here, including Lucy from all these years. So as Lucy's boss, I had my annual review meeting with Lucy just, I think, 3 days ago, and I guess I should point out Lucy published more papers last year than I did, but we won't dwell on that. So something I'd like to mention about Lucy is, I attended Penn Medicine's graduation ceremony this year. And something that they do that I think is very nice is that every year at graduation, they have several members of the medical student class who graduated 50 years previously attend and speak some words of welcome to the students who are graduating, some of whom will no doubt practice medicine for an additional 50 years. That concept is that within that room, in the Kimmel Center, where the orchestra plays, you have physicians who span 100 years of clinical care. And something that one of these individuals mentioned as he looked out on the very diverse student population of Penn Medicine, graduating class of 2015, is that in their class of 136 students, there were but 3 women. And I dare say 50 years ago, Penn Medicine wasn't a paragon of racial diversity either, so it was probably 3 women and 133 run-of-the-mill white guys. And how things have changed. And looking at pathology at CHOP today, we have 30 faculty on the clinical side of the department. More than half are women. Half of our division chiefs who form our executive team are women. In just 2 short weeks, CHOP will have the first woman CEO, Madeline Bell, who's here tonight. So things have changed tremendously. Lucy's a trailblazer, and Lucy, thank you for showing the way.
Thank you, Bob. I suspect you may want to start eating your salads. Lucy, is that okay? I have to check with Lucy because everything's organized by Lucy, but we got her permission. So please start your salad, and I'll ask Pierre Rousseau to come to the podium, please.
My name is Pierre Rousseau, and I'm Director of Anatomic Pathology at CHOP. My name tag says Lucy's immediate boss. But it's actually Dr. Rorke who hired me. So I'm rather ambivalent about the title here. But Dr. Rorke, Mr. Knowles, dear friends and guests, having known Dr. Rorke for over 18 years, I find it difficult to sum up my impressions of this dame formidable in a few short phrases. However, I vividly remember the first time my wife Sylvie and I got to know Dr. Rorke, and that was during an intimate dinner in Montreal, where we were living at the time. We had arranged to meet Dr. Rorke, who came into town for a neuropathology meeting. And when we met up with her, I noticed she was only carrying a small overnight bag. And I asked her, "Don't you have any other luggage?" Of course, I didn't really know her at the time. And she looked at me a little bit sternly and said, "That's all I need." Well, anyway, during that dinner, Dr. Rorke held us enthralled by the extraordinary saga of her family and by her experience as a female medical student in the 1950s who was determined to succeed despite the entrenched hostility around her. During that dinner, she also convinced us, in her clear and sensible way of thinking, why a move to Philadelphia was in our best interests, advice that after so many years, Sylvie and I are grateful for and have never had cause to regret. Several years later, Dr. Rorke and I were walking together to a faculty luncheon meeting, and Dr. Rorke walking with her usual brisk, determined pace in her pumped shoes. Arriving at the faculty hall, she proceeded to bound up the steps, leaving me behind and somewhat amazed, and in admiration of her energy and her enthusiasm. And I know that these are the qualities that led to her success, not only in overcoming obstacles in the early part of her career, but also when, as an established neuropathologist, she challenged the conventional wisdom and the giants of the time and offered a whole new vision of classification of pediatric brain tumors. I must also say that I had the opportunity to observe Dr. Rorke outside the hospital setting, namely in the courtroom, where we both acted as consultants in the National Vaccine Injury Prevention Program. I witnessed her stoically withstanding the often demeaning and frequently insulting questioning by the lawyers, and saw her then, her ability to patiently and relentlessly demolish the arguments brought forth by opposing so-called experts. So Dr. Rorke, and I will always call you Dr. Rorke, despite your repeated entreaties to call you Lucy, I will always be grateful for your generosity and for the counsel you provided me, and that I know so many of your colleagues have benefited from over so many years. Thank you.
Thank you, Pierre. Ed Notebaert, please.
Hi, I'm Ed Notebaert, and I was actually going through a little bit of reminiscing as I listened to Chad read the letter that came back to me, vividly. And then as I listened to Dr. Russo, I realized that he and I also had something in common. Because when I was interviewed for my position at Children's Hospital a long time ago, I sat in the office waiting for the first person to come and interview me, and she walked in. And, I was a nervous wreck, but I thought, well, this is a nice way to start. She seems like a very nice lady. And she stood in front of me and said, "Hi, I'm Lucy Rorke. I'm president of the medical staff." And I thought, oh my God, I'm in trouble. And so when I heard Dr. Russo's description, she hired me too. So, I had to pass muster. I learned that later, that she said to the board people, he's probably okay, and I think it'll work out. From there on, it was a constant, Chad, I really didn't convince her to be the chief of pathology. It was just kind of an ebb and a flow, and when Lucy would come in and tell me she needed another fellowship funding because there was this wonderful doctor named Jeff Golden she had to have to teach, I realized that the best way to work with Lucy was to follow her guidance. Don't make it too easy, because then it gets really out of control. But on a more serious note, I learned over the years from Lucy what mentorship really means. Indirectly, she did a lot of mentoring of me, but I watched her teach fellow after fellow, and I saw the fellows that she taught go out into the field and expand the scope of knowledge that she had into many, many different spheres. And Lucy, I think the other day you and I were trying to count them up, somewhere between, was it 75 and 100? That is a lot of fellows to teach. And so the huge impact that you have had in neuropathology and in pediatrics in general is, I think, probably some kind of a record. I want to personally thank you for all the mentoring that you gave to me. There were moments of great frustration when you provided me with free therapy and calmed me down and it contained some of the things that I wanted to do. And I thank you for your friendship. And I honor the work that you've done here. And I just don't know what to say except thank you for your friendship and for all that you've meant to CHOP and all of the children of the world. Thank you.
Thank you, Ed. Pat Pasquarello, please.
You may not be able to see me, but you can hear me. It's really an honor to be here to honor Lucy, a friend and a colleague. And Lucy, thank you for inviting so many of my friends and people I haven't seen for a long time. Thank you. Lucy started her internship at PGH, Philadelphia General Hospital, which was run by the city for indigent people, and was one of 100 and some interns. And she worked her butt off really hard. She covered for people who were sick and so forth, and got very little rest. But went into pathology, and at the urging of her first husband, Bob, got a fellowship in neuropathology, which was probably the best thing he ever did besides marry you. In 1965, Dr. Kennedy, who was chief of neurology, asked Lucy to straighten out the neuropathology department. At that point, it was really a mess, and the rest is history. For 50 years now, she's run a wonderful department, which is famous all over the world. Lucy spent a lot of time doing autopsies, and because she was a girl, her boss said, she should do all the pediatric autopsies because girls associate more with kids than men do. I don't know who her boss was, but he wouldn't last much nowadays. In any case, she did like 500 pediatric and 1,200 total autopsies a year, so she was a pretty busy young lady. Lucy spent most of her time in what I call the academics triangle. It's this area that is eastbound by 34th and Civic Center Boulevard. On the west side is 38th Street, and then to the north is Spruce Street. So she spent a lot of time at the PGH, the examiner's office, then the Abramson and medical school, the whole bit. So she spent a lot of time there, but she also spent a lot of time traveling, going to other institutions doing research at Toronto Children's. She went to Worcester working with Stan Plotkin and Mike Katz making vaccines. She also traveled the world, and it was during her travels in the world that I met Lucy in 1983 in the international terminal at the Philadelphia airport. We were a group of 20-some people going to China. We were invited by the Chinese Medical Association to go over there and teach. We did a little bit of teaching, and I'd like to digress a little to mention that there was quite an experience teaching Chinese people, because you would say a sentence, and then the interpreter would say a sentence, and then you would say a sentence and go back and forth, and you never knew if the interpreter was saying what you were saying. So I decided what I would do is every once in a while I would tell a joke. And if half the people laughed, then I knew they understand the joke. And then when they interpreted, the other half laughed, then I realized that they were probably interpreting it properly. So that's the way I got around my lectures. But we did an awful lot of traveling, and my first impression of Lucy was a big question mark. I saw this white-haired lady sitting in a chair tatting. You know what tatting is? It's crocheting doilies. And there she was crocheting doilies, and I said, either she's a social outcast or she doesn't let grass grow under her feet. She doesn't waste any time. Well, you know the answer was B, okay? I mean, she kind of took over the group, and she was quite a leader. Every evening, we would all meet at someone's room and drink all the Canadian spirits we could find, and then we'd go to dinner and have a wonderful time. And Lucy proved to be a good leader. And as we were leaving, going down the Yangtze River, Lucy is standing in the front like that mermaid in front of a Viking ship, and she's kind of telling the captain where to go down the locks, okay? And because there's a lot of debris in the Yangtze River, including, well, a lot of debris. Okay. In any case, we got home, and Lucy became a good friend and colleague. And thank heavens I never had to send any patients to her for her expertise. It's been a pleasure knowing you, and enjoy your retirement, and don't let any grass grow under your feet. If you don't have anything to do, tat.
Thank you, Pat. Bob Zimmerman, please.
Lucy, it's a great honor and pleasure to be here in your honor. You're the deserving person of anybody in this audience for the honors that have been bestowed upon you. Over the past 41 years, I've had a chance to work with Lucy. I'm a neuroradiologist interpreting images, and in order to interpret images, you need to know what the neuropathology of the lesions are. You need to be able to have that information and understand it. To this end, I've had the greatest opportunity of learning this understanding of the significance of neuropathology from a great teacher. She is the final arbiter of CNS disease, presenting the images to which she correlated the pathology, both at biopsy and autopsy. This provided me personally with the stimulation to be the best that I could be. To be honest, I feared making an incorrect diagnosis. I still do. To be fair, Dr. Rorke always corrected me in a reasonable and appropriate manner. In writing manuscripts together, I was amazed at how much red ink or corrective pen held. However, the result was a precise and correct contribution to the literature. In essence, she was and still is the final arbiter of the correct diagnosis. Lucy, we love you.
Hi, my name's Paul Offit. I'm one of the attendings in the Division of Infectious Diseases. I really first came to know Lucy well a number of years ago when I was working on a book called Deadly Choices, How the Anti-Vaccine Movement Threatens Us All. And actually, Dr. Russo referred to this, but I was trying to understand the workings of something called the National Vaccine Injury Compensation Program, which is a kangaroo court, basically, whereby plaintiffs' lawyers were able to extract money from the federal government for claiming that vaccines cause things that basically they don't cause. And so I talked to a number of people about this that are involved in the court on both sides of the aisle, and the only person who was really willing to step forward and tell me exactly how things work, to name names and to go on the record, was Lucy Rorke-Adams. And I just can't tell you how much I appreciate that. Lucy, you taught me how to be brave. I mean, you taught me to stand up, and it's really helped to expand my circle of hate, and I appreciate that. Thank you, Lucy. It's been wonderful for me. You taught me a lot, and I'm going to make sure to forward my hate mail to you a little more than I have in the past. So, thanks. Thank you.
Thank you, Paul. Derek Bruce, please.
I think I can call you Lucy now, after all these years. I must say, this is just an extraordinary super time. It's my absolute pleasure to be here. I was thinking, I first met, or at least encountered Lucy at the old PGH when I was a first-year neurosurgery resident in 1969, and then at the old Children's in Bainbridge Street 6 months later. But it was really when I joined Children's in 1975, after I finished my residency, that I really began to be influenced by Lucy, who, from my point of view, is sort of a genius of Gestalt. I mean, at a time when recognition of pathology was looking at slides, we didn't have fancy stains, we didn't have anything, but there was this, Lucy would look down and say, "Don't you know what that is, Derek?" And my answer usually was, "No, I don't." But I remember the very first real encounter with Lucy that I remember was was a young staff member at Children's, and there was a difficult kind of tumor called a craniopharyngioma, which goes at the base of the brain. And in my residency, I had never seen anyone take it out completely. But there was this guy in Switzerland called Yassagil who was apparently able to do this. And so even before I met Lucy, maybe I had a little bit of an ego and desire to do well. After I met her, it was horrendous. But so I operate on this child, and I was so proud of myself. It was just in the CT area, and I thought I'd taken out the craniopharyngioma completely. So 2 or 3 days later, I get a call from Lucy. "Derek, I think you should come up to my office." So I went up to Lucy's office, which was a very small office, with a double-headed microscope, and completely wall to wall and floor to ceiling with slide boxes and all over the place. And I sat down on the other side of the microscope, and Lucy said, "What are these?" And I was looking at cells, and I must say, I was sort of proud of myself. I said, "I think they're neurons." And Lucy said, "Yes, Derek, they are. Why did you take out this child's hypothalamus?" Now, the hypothalamus is this little critical area of the brain that when you take it out, people die. So I felt a bit like a kid caught with my finger in the cookie jar, you know? So my immediate response was, I didn't. And then I had to explain to Lucy the child was alive, doing well, seemed to be functioning well, and I was sorry I'd taken out a few neurons. Well, the point of that was that then we actually understood that these peculiar tumors didn't have a capsule, did invade with this sort of fibrous astrocytic response, but with neurons in it. And that part of taking them out was to try to take as few neurons as possible. So that was my first introduction. And this was the time that CT had just been introduced, and then a few years later, MRI. And we had this incredible group of people with Lucy, with Dr. Blanning, Dr. Zimmerman, neuroradiology, neurosurgery, because for the first time in history, with the CT scan, we could actually see the brain. That every other test we'd had up to that point demonstrated blood vessels, cavities, but we never ever could see the brain. And of course, we had no idea of what we were looking at. And yet we were treating these children on the basis of these incredible new studies. So it was an interesting time. And the next response I remember from Lucy was that we would sit in these conferences and look at these scans that had these great big tumors, several centimeters in size. And at one point, Lucy said, "Well, Derek, if the tumor's 2 centimeters or 3 centimeters in size, how come I only get 4 cells to study?" And again, you know, we were caught out. We had to explain. It was very difficult. They bled. We had to suck them up. But knowing Lucy, we worked a little harder to get her more tissue. But the point of that was that now with a lot of tissue, the whole concept of what we were dealing with changed. Because Lucy was seeing with tumors that she'd only had a tiny bit, now there was lots. And these tumors were not all the same. And they weren't all the same medulloblastoma. And then we could correlate with the scans what the tumors looked like, how the children did with the pathology. And all of a sudden, this was, you know, a really big deal. And that happened also for me with Lucy with pineal tumors. We'll talk about it a second later. The other thing I remember during these years was that the preemie children in the ICU often had cerebellar hemorrhage when they died. And no one could explain why they should have cerebellar hemorrhage. I remember being in an autopsy with Lucy and pointing out that, you know, these were venous hemorrhages. In other words, they were veins that were bleeding, not arteries. And we ended up thinking about this. So the reality was all these little infants were ventilated with a tube in the trachea, with a roll underneath their necks. And these were thin muscles, thin bone, and almost certainly we were compressing the veins from the cerebellum. And that was producing the cerebellar hemorrhages. So again, you know, long before we even thought about transitional medicine, we had, in fact, pathology, neuroradiology, neurosurgery, clinical medicine, actually combining to make some sense of all these new things we were seeing. So that was another really big deal for me. The last clinical story I'll tell you was probably, for me, maybe the most impressive ever. I was operating on a 6-year-old at Children's here, and this was a little boy who presented with intractable vomiting and had on scan a really small lesion sitting in what's called the obex of the fourth ventricle, which is the lower part of the brain and is where the vomiting center is. And a very difficult place to operate, and we often had kids who couldn't breathe, couldn't swallow afterwards. And it turned out his sister supposedly had had 2 operations at Hahnemann for a cerebellar astrocytoma, a kind of tumor. So I went in and I operating on this, and I send the usual tiniest conceivable biopsy I was brave enough to take from this area of the brain. And we're standing around in the OR waiting for the response from, I know Lucy is religious, so I won't say God, but as I'm not, I thought it was God. And all of a sudden, the intercom goes off, and I'm expecting Lucy to tell me what this is. And her first response is, Derek, stop. Whatever you're doing, close up and get out of there. And I thought, oh, sorry, God. And I said, well, what is it, Lucy? And she said, this is focal Alexander's disease of the brainstem. Now, I was a little older by then, and I thought I was important. So I thought I might just take Lucy on this. And I said, Lucy, Alexander's disease affects the hemispheres of the brain. It gives you a big brain. It affects infants. They don't live long. They're retarded. So it can't be. So she said, Derek, do as you're told. So in fact, I did. I closed up. And about 45 minutes later, I came out of the operating room. And there's a stack of reprints this high, because these were the old days. We didn't have computers. We had reprints on the desk from Lucy for me. And these were all cases of brainstem Alexander's disease. Not one of them had been diagnosed in life. They were all children who had been misdiagnosed for other things. And I thought, holy God, this woman has just diagnosed the first case of focal Alexander's disease in the brainstem in a live person. And that for me was what Lucy was all about. I mean, there was just this invariable sort of aura of, you think you're really smart, Derek, but I'm a wee bit smarter. And the final short tale, in 2000, Lucy and I were together at a meeting in Martinique. And on the way back, the airport was on strike. And there were a bunch of very large people trying to stop us getting through customs to get on the airplane. And so we sneaked upstairs, and there were two lines. So our colleagues went through one line, and we were going through the other line. And this is this very, very large striker who's in our line, who's saying, sorry, you can't get through. And it looked to me as though he was going to actually start physically pushing Lucy around. So wanting to be her knight in armor, I jumped in front. And I said something like, how dare you handle that old lady that way? Well, not too long later, I went home, and Lucy had been talking to my wife, Frances, and pointing out that, how old does your husband think I actually am? And of course, I was completely wrong. Lucy has never aged. I suspect never will age. And I think, Lucy, what I got from you that totally affected the rest of my life was that your approach was never self-aggrandizement. It was always perfection, teach enlightenment, do the best you could. And if you really did the best, probably there wasn't anybody who was any better. So there was a little bit of ego in that as well. But and for me, that was it. I always wanted to be perfect. I'm not sure I ever quite achieved that, but I must say, it's my absolute pleasure to be here and to say thanks to you, an extraordinary doctor, a great human being, and a wonderful mentor.
Thank you, Derek. You notice there's a bit of a theme here of people listening to what Lucy says, including neurosurgeons, which is quite a remarkable admission. So thank you, Derek, for being so brave. Cindy Christian, please.
Hi, Lucy. Good evening. Good evening, everybody. My name is Cindy Christian. I need my glasses. and I'm a pediatrician at the Children's Hospital of Philadelphia, and I am honored to have been asked to toast Lucy this evening, representing not only the international child abuse community, but from my review of the list of official toasters, also representing women. I spent a little time this week rereading Lucy's brief autobiography, which is a fabulous memoir of medical education in the mid-20th century. And although women physicians were much fewer in number back then, some of Lucy's most important mentors were women, such as Dr. Helena Riggs, a neuropathologist at Philadelphia General Hospital. I first met Lucy in 1984 when I was a visiting medical student contemplating a career in pediatric pathology. The pathology department at CHOP had never had a medical student rotate with their service, and I'm not sure that Dr. Witzleben knew what to do with me. I distinctly recall my introduction to women in medicine that month at CHOP, watching Anna Meadows at Thursday afternoon tumor board and Lucy differentiate astrocytomas from ependymomas under the group microscope. These two women were tough cookies, incredibly accomplished physicians who didn't suffer fools lightly and were a little intimidating to a young, impressionable medical student. Little did I know then that both Lucy and Anna would be important influences in my career, inspiring me to set high standards for my own work. Lucy and I share a number of traits. We are both petite, but only in stature. We both appreciate a beautiful diamond, and both of us are girls who can't say no. Lucy ascribes this last attribute to her great career success, never turning down a colleague who had a question related to neuropathology. When I think back on my own career, I think that much of my success has also come from almost always saying yes to opportunity. Lucy and I have worked together in the field of child abuse and head trauma for decades, and I have benefited tremendously from her extraordinary knowledge, personal counsel, and steadfast support. Her door is truly always open, with lovely classical music playing on that old radio, and she always has time to answer questions, review pathology slides, and work on challenging clinical issues. Lucy never backs down from a controversy, and she has been a champion to the child abuse community, representing what clinical and neuropathological data have supported for decades, that abusive head trauma exists against recent challenges by a small but vocal cadre of physicians and lawyers. Just this past year, Lucy represented the child abuse community at a national symposium sponsored by abusive head trauma denialists and provided the most cogent and acerbic talk on cognitive bias in forensic medicine, turning the argument back on the conference organizers. This was a thoughtful and brilliant talk, and all I could think when I read Lucy's remarks was that she was a pistol, and I use that in the most flattering use of the term. Although many decades separate Lucy and her many ardent fans in our child abuse community, I speak on behalf of all of my child abuse colleagues in thanking her and congratulating her. As Lucy has written, good doctors, like good wine, increase in value with age. And so I would like to make a toast to Lucy Rorke-Adams, our own bottle of Chateau Lafite Rothschild. Congratulations.
So it's truly an honor for me to be up here. I came here as a medical student and first met Lucy at that time. She gave me advice on what to do throughout my career, and I came back because she recruited me back here. And over the years, I actually came to become her boss, if that's possible. Actually, that's not ever true. And then 3 years ago, I left. I'm not sure she's forgiven me for that yet, but we're working on it. So that's just a little bit about my background. I can tell you I would not be here today if it wasn't for Lucy. I would not have achieved anything that I've achieved if it wasn't for Lucy. So as I started trying to put together my thoughts on what would I say today, I started reflecting on something that Lucy loves. Lucy loves books. She reads all the time. She shared books with me. We had many conversations about those books. And I started to think about what could I say and kind of bring together in these 8.5 decades or so of her life that maybe might be reflected in books. And I started thinking about how I'd put that together. And then I was told I had 5 minutes. So we're going to have to make this a little shorter than I wanted, because I'm going to tell you about a few chapters of this book that would be Lucy Rourke. And you've already heard about many of those. Each of them could be a novel in itself. You've heard about music, which was early on in her career a love and has persisted throughout her life. You've heard about vaccines, her work that was pioneering, work that she did across at the Wistar Institute, working tirelessly above and beyond all her clinical responsibilities. You heard that she had to do hundreds and hundreds of autopsies and surgeries every year, and she was also doing research full-time, NIH-supported research, things that we struggle, some of us, certainly myself, struggle to do today. She was doing all of that, and, by the way, running departments and being the chief of medical staff, even the CEO of CHOP at one point. Multiple sclerosis. We haven't heard about that today, but another area where she spent a tremendous amount of time and made seminal advances in our understanding of this disorder as well. Tumors. Lucy, as president of the American Association of Neuropathologists, the leading association of neuropathologists, changed the classification. But it wasn't that she changed the classification. It was that she challenged what was dogma. And she recognized, based on what she did, that this was the right way to do things. This was the way we need to look at it. And today, because of what she did back in the early 80s, we have a better understanding of tumors because they were stratified in a way that we can now understand the molecular basis of them and treat them accordingly. This is the foundation of personalized medicine that she started back in the 80s. In fact, there's a tumor that she described, the atypical teratoid rhabdoid tumor, for the first time by distinguishing it from these other types of tumors that were all lumped into one group. Malformations. She's had a long interest in what is still a huge problem in the pediatric world. Lucy, though, didn't take the usual route. She went and looked at what was happening in developmental biology, where there was very little intersection with what was happening in the 80s on malformations. And she recognized the importance of these model systems, a little worm called C. elegans, with exactly 302 neurons, every one of them mapped. She understood the genetics that could be done with Drosophila. And she took those understandings of what happens during development of model organisms, and she began applying them to human disease. In fact, that's what I've spent my entire life doing, and she was what started that as well. You just heard Cindy talk about non-accidental trauma. We've heard, and so I don't need to cover that any further. You've heard about her as an administrator, you've heard about her as a teacher, and you've begun to hear about her as a mentor. And I think everyone in this room at this point appreciates what she has done for so many people in this room by being a mentor, by allowing us to make mistakes and help guide us when we needed that guidance. What I think is clear is that this book, with all these chapters, is a page-turner. It's one that's a truly captivating novel. And there's some other parts to it, some other chapters. One I'm particularly proud of, and I know she is as well. 6 years ago, on the occasion of her birthday, we were able to raise funds, particularly with the help of the Children's Hospital, to create the Lucy Rorke-Adams Endowed Chair in Pediatric Neuropathology. This is an indelible contribution to pediatric neuropathology and neurosciences that will enable an enduring contribution linked to this individual who has herself contributed so significantly. As I mentioned, I first met her 25 years ago or so, and to me, she has been that teacher, mentor, colleague, friend, and as many of you have already heard and says on my badge, she's been my surrogate mother here on the East Coast. Ludwig van Beethoven once said, "To play without passion is inexcusable." I'm certain that if Lucy would have pursued her career in music, she would have done it with passion and she would have been a success. But that statement is no less true about the path that she chose in medicine and neuropathology. She often says, you need fire in your belly. It's one of the things she loves to say. She looks for those people that have fire in their belly. And I think she needs to look no further than the mirror to see where that real fire in the belly is, because that's what has stoked her throughout this career. She enabled my career in so many ways, and I'm just going to give one caveat that I think personifies what she did. Well, shortly after I got to the Children's Hospital, she was to go to Australia for an International Congress of Neuropathology. And just before she had to go to that meeting, she was actually subpoenaed and was not allowed to leave the country. And so she had to stay here. But instead of just what most people would have done, sent in a apology that you can't go, she said, "Jeff, you have to go for me. You have to stand up there. You have to ask questions." She put me in a place to be successful. Now, I always looked at it that way until I was thinking about it recently where it was in Perth. And I think what she really wanted to do was get out of the fact that she had to get on a plane and fly 6 hours to Los Angeles, then 15 to Sydney, and then get back on another plane to fly another 4 hours to Perth. But fortunately, she got the lawyers to pay for it in business class for me, which I appreciated then. While Lucy is retiring from neuropathology, I don't think this is the end of her discovery. In fact, I recently learned when I was at the opera with her a little over a month ago that she's turning in her microscope for a telescope. And I expect that we are going to be learning about Comet Lucy and other discoveries in the near future. We all, Lucy, anxiously await hearing about these new discoveries and these yet unwritten chapters in this extraordinary book. Please join me, everyone, in congratulating this really remarkable person, Lucy Ballion Rorke-Adams, on an extraordinary career and for the person that she is. Many more exciting discoveries, and thank you for everything.
I am very pleased to introduce the incoming Chief Executive Officer of the Children's Hospital, Madeleine Bell, and Madeleine will take care of the festivities from now on. Thank you. Yes, you are. So welcome, Madeleine, and congratulations on your promotion.
Thanks, Brian. I didn't know it was my role to take over the festivities, but I will be the first person to open the open mic night. So this is our chance to call people up to talk about Lucy. And I will begin by saying that I have known Lucy a very long time. And earlier this evening during the cocktail party, I noticed a long line of people waiting to get their picture taken with Lucy. And I was walking by, and our photographer, Paul Crane, who's taking pictures of me now, just looked up and said, "I know she's a rock star," which is absolutely true. He got it right. And Lucy, you've proven to me that you can really hang with the men. In fact, I learned tonight that you can direct them and lead them. But what I really love about you is, as much as you are tough, you also have an amazing feminine side, which I've learned. And one time I was walking from the Abramson building to the Seashore House building, and I don't know if you remember this, on the bridge, and you ran up to me like a 25-year-old woman, and this is not that long ago, and said, "Look at my engagement ring." And and she had such a sparkle in her eye, and that engagement ring was like a skating rink on her finger. So like Cindy said, she loves a good diamond. But anyway, I just love that you also have a strong feminine side, and something that I admire about you. And in 2 weeks, I will become CEO here at Children's Hospital, and I have to say that I'm absolutely certain it's because of women like you who really paved the way for me. And you always have been and always will be an inspiration to me, Lucy, so thank you. And now I'm going to open it up the mic for other comments. I think there's somebody already in the wings waiting.
I have the privilege of being able to make a few comments about Lucy. There were so many comments made that I would not be redundant, but I'm going to ask you to think back to 1964, even though I realize that a majority of you cannot think back that far. On the other hand, Lucy and I can, and it has been my privilege to have worked with her since then until a variety of other times. Lucy and I were interested in the pathogenesis of a particular disease of children, subacute sclerosing panencephalitis. She studied originally with one of the original describers of this disease, and when I needed some pathological help, people said, "You should go and see Dr. Helen Riggs," whom I did go to see. She was at the Philadelphia General Hospital, and she introduced me to Lucy. And that was a marriage, and I use this word very carefully and in rather narrow definition, that lasted since then. Lucy instructed me in a variety of aspects of pathology of this, and one of my responsibilities had been to be able to pick up fresh brains of children who died of this disease, because it was a universally fatal disease. It involved driving into rather distant hospitals, and I needed to be able to do this carefully, and she instructed me how to do this. However, when I brought a specimen once back to her and asked her how it was, she said, "Well, it had some artifacts of removal," which was about as gentle a chastisement as one could imagine. Anyway, Lucy and I remained friends. We presented our data after a lot of people believed that we were incorrect at an International Congress of Neuropathology in Paris. And as we were sitting there, we saw a person get up, whom we never knew, who was from Hungary. His name actually was Ovary, but that was another aspect of that. And he said, according to his data, what we did, in fact, was replicated. And that was the first time that we've had some encouragement in the work that was very difficult and not always very easily accepted. But Lucy and I had another aspect in our lives that we shared, love of music and also love of good humor. And I remember, and she may not, that when Italy declared divorces as being legal, there was a cartoon in the New Yorker of a man walking by an entrance to a music hall where a poster was that it was presenting Il Divorzio di Figaro. And I was calling Lucy on the phone to tell her about it while she was calling me to tell me about that. Lucy, thank you for all these years, and I look forward to many, many others.
I have a very brief follow-up to Michael Katz's comments about humor. My name is Lou Bell. I'm the Division Chief for General Pediatrics at CHOP and have known Lucy for 32 years. We've heard about her amazing expertise and scholarship in neuropathology. We've heard about her bravery and straightforward ethics and commentary related to vaccines and child abuse pediatrics, her leadership and mentoring. But this is really about humor and whimsy. And my name tag says Lucy's favorite cleaner. And we didn't plan this, but I have a note that she wrote to me. So I was walking down the hallway and I was limping. I had cracked my right medial meniscus. And she said, Lou, what happened? Why are you limping? And I said, well, I had stooped down and I was wiping up a spill on the kitchen floor. And I heard, when I squatted, I heard a pop. And ever since then, I've had this, and I had an MRI, and I have a cracked meniscus, and I need to get it taken care of. And she said, oh, well, I hope you feel better. And the next morning, I walked in, and there was a mop and a bottle of Pine Sol on my desk. And it had this note, and this was, and this is what it said. So 18 March 2000. Dear Lou, a few items to take the stress off your back and knees. I presume you already have a pail. So just use a tablespoon or so of pine soil into some warm water, dip in the mop, squeeze, wash down the floor. It will take only a quarter of the time as the hands and knees technique. Good luck, Lucy R. So, and I've kept this card because every time I think of Lucy, and I see her often in the hallway, it makes me smile. So, Lucy, thank you.
My name is Alex Judkins, and my name tag reads a successful student, which I'm pretty proud of, actually. I'm going to take a picture of it so when it fades, I can still show that to people. I'm back in Philadelphia tonight for the first time in 5 years, and as I look around and sort of take in some truly amazing things that have happened here at CHOP that are really impressive, it does remind me that there's still a fence over there from PGH, and it reminds me to think about all the changes that Lucy has seen in 50 years. And it must be a pretty impressive and pretty breathtaking thing to sit in her seat and think about all the people who aren't here, all the people who made big contributions, and we're grateful that she's a link to that for each one of us in our own ways. I'm just going to say a couple things, and only from the perspective of student. So the first is mentor. If anyone who's been mentored by Lucy, one of the qualities of mentorship that Lucy does not have is giving praise lightly. This is not bad. It's not bad, and Jeff actually touched on the really great quality that she has as a mentor is that she freely gives you opportunities to do big and difficult things. And that's so important because it gives you the confidence to really go out and accomplish something. The second is she has standards. I think that's been touched upon a few times here tonight, and there's been some great anecdotes. I just want to share one other, and I apologize for the civilians in the room here where people talk about brain cuttings. It sounds very morbid, but at the medical examiner's office, where I first got to know Lucy as a resident, we would have brain cuttings. But these were not like hospital brain cuttings, because these were attended by police officers and ADAs and all kinds of other people, big sort of muscular guys who wear guns and flashlights. And Lucy is an equal opportunity teacher. And so she would just start asking questions. And all of a sudden, you'd see all these big, strong guys start to fade back to the back of the room. And invariably, by the end, they're all clustered back by the door, kind of all sort of. So Lucy has standards, and everyone learns what those standards are, and it makes us better. She's indefatigable. Lucy explained to me after I worked with her at the medical examiner's office, I should just do what she did.
I said, okay, just sort of line it out for me. How does this work? And she said, well, at about 5 o'clock in the morning, I get to the medical examiner's office, and I work there until 8, looking at cases. And then I go over to CHOP, and then around 3 or 4, I go back over to the medical examiner's office until 5 or 6 and finish up the cases. I said, great, sounds awesome. Where do I sign up? For 50 years, Lucy's been doing, at a minimum, at least 2 or 3 jobs, and really many more all the time. And as a student, not only does that teach you that you have to work hard, but it means that you start to learn that you have to say yes. You have to take opportunities when they come to you. She's curious. You've heard that, and it's such an important quality. And the older I get, and I'm not very old, the rarer I find it. The incurious seem to have taken over this world. And so your curiosity, Lucy, is such a wonderful virtue. I'll just end by saying there's one quality above all that accounts for these characteristics together that Lucy has. And you've heard it throughout all the stories this evening, and it's Lucy's essential generosity. Lucy, thank you for a generous heart and spirit and making a place for all of us to be your friends, your mentors, your students, and your colleagues. Congratulations and thank you.
My name is Larissa Bilaniuk. I'm a neuroradiologist at CHOP, and I've had the great honor and privilege to have worked with Lucy for over 40 years. But one aspect that I want to emphasize that has not been brought up is that Lucy is a woman of a great heart. She's a wonderful human being, able to show very sincere empathy. And I can say it from my personal experience. When I was going through my tragedy, Lucy called me every week, sent me cards, and sent me flowers. In her busy schedule, she never forgot about me. And I thanked her for that. A wonderful human being. Now, on a lighter note, Lucy has shown quiet elegance as a woman in her beautiful Thai silks and Ferragamo shoes. And lastly, which is magical, how did you manage not to gain a pound during all those 40 years that I have known you? Thank you.
My name's Bernard Kaplan, and my wife has made me do this. Larissa actually took the words out of my mouth, but I still want to say what I have to say. Fortunately for me, I'm a pediatric nephrologist, not a pathologist, and certainly not a neuropathologist. When I first walked into the autopsy room 27 years ago or so, and I saw this lady cradling the brain of a child in her hands, like Hamlet holding the skull of Yorick, it made an indelible impression on my mind. And I thought, thank God I don't have to work with her. Well, anyhow, Lucy and I ended up being on Ed Nodabart's executive committee, which gave us a wonderful opportunity to gossip about him. And we became friends. And I talk about Lucy not as a colleague and not as a fellow physician, but Lucy as my dear friend. I would go and visit you, and I'm going to miss visiting you. I would go to pathology and say, where's my girlfriend? And they would say, she's here, or she's gone, or you've come too late. And if I missed her, she would say, where have you been? Stranger, where have you been? But I wasn't her only boyfriend. There were all these people, you had to push people out the room to get an audience with Lucy. Well, we also had a terrible tragedy in our lives. And Lucy was absolutely wonderful to me. And that's part of you, Lucy, as this amazing soul, but also your psychological training, which nobody has spoken about this evening, that you were also a psychologist. My goodness, Lucy, you were a psychologist and a neuropathologist. What a combination. And what else can I say? I think someone said it earlier. I love Lucy.
I'm Janet Weldon. Don't you love our name tags? Mine says it started here. I may have known Lucy longer than anybody else in this room. We met in 1958 when she was at PGH and my brother-in-law was on his public health service at PGH. He went into the cafe, eating lunch, sat down at the table with this woman that he had never met before. He was commiserating because his wife, my sister, was in the hospital, and grandmother had to take the 2 children, and she was tired. And Lucy, not knowing this gentleman at all, said, maybe I can help. She was on call all night. She borrowed a car and came out to Delaware County and took those 2 children off the hands of my mother, drove back to PGH, and was on call all night. That's Lucy's humanity. You all know about her medical skills, but I want you to know about her love and her humanity. Thank you, Lucy. It's been a wonderful time knowing you.
My name's Nancy Spinner, and I'm a member of the Department of Pathology. And what a spectacular event tonight, just absolutely amazing. And I want to say what a spectacular time to be a woman in science, and in no small measure because of the efforts of Lucy and some of her colleagues. And I have 2 anecdotes to talk about, to mention for Lucy, and speaks to, I want to continue the theme that Cindy put forward, being able to show your feminine side while you're also able to show your prowess as a physician and a scientist. And I remember going out to lunch. My colleague Jackie Beagle and I took Lucy out to lunch shortly after the death of her first husband, and we wanted to do something nice. We admired her. We knew this must have been a hard time. And what I remember was talking to her, hearing about her love for her work, and also about her love for fine fabrics. And she was talking to us about her trips to the Far East and some of her shopping expeditions, and I thought, this is so cool, because it's okay to love fine things and to love beautiful things and to still be such a successful scientist. And my next anecdote is when she was the chair of pathology, and I was a young faculty member, and I wanted to go ask for my first raise as a young faculty member. And it was an intimidating situation, and I went in to talk to Lucy, and I said that I felt like I had done very well and I was deserving of a raise. And she looked at me and she told me that, in fact, she understood that sometimes you had to ask for things, that she hadn't asked for things earlier in her career and realized that there were a lot of things she was owed. And she was going to make sure this never happened to young women again, because this was something that was hard for us to do, and she appreciated it. And she evaluated things, and I can't remember, but I'm sure I got a great raise that year. So I appreciate all of your efforts. You really paved the way for so many of us. You stood up for us when you had the opportunities to do that, and you were a role model in oh so many ways. And I thank you, and it's really been a pleasure to know you and to watch you and achieve your successes. Thanks.
Well, my name is Joel Crott, and my wife is not making me do this. But she made a strong suggestion, and there would probably be consequences if I didn't follow her suggestion. Anyway, I'm probably the first person that's not a medical professional to speak, but I am a musical professional. And there's kind of an implication in the discussion that Lucy's a music lover, but sort of had an abortive experience and decided not to be a musician and be a physician. But that doesn't mean she's not a music maker. And those from the Presbyterian Church will understand this, but Lucy in that church was enormously encouraging to me and enormously supportive to me to build over a long number of years, practically as long as she's been here, a music program which in particular fosters singing and spirituality for children and teenagers. So she's kind of expressed support and her love of children, not just in medicine, but enabling a good children's and teen choir program to happen. And so I wanted to say thank you to that, and to not let anybody think that she has been absent from the musical career, but indirectly has done a great deal to foster music in an important place. And at our table, there was a lot of discussion about, well, now what's Lucy going to do? And I do have a specific suggestion. Think about September 10th, Thursday, September 10th. That's when the adult choir begins. Now, it's not like an opera stage, but if you give the word, I'll have a folder and a seat for you in that rehearsal room.
My name is Dana McMullen, and my name tag says Miracle Girl. I just wanted to take a minute to thank Dr. Rourke, who I call Aunt Lucy. I've known her since I was 3. It was a long time ago. I first presented to Children's Hospital when it was at the Bainbridge site with what was believed to have been a medulloblastoma, and many other clinicians were saying that was the case, and presented a grim prognosis to my parents, but Dr. Rourke, Aunt Lucy, found otherwise, and encouraged the surgeon to remove the tumor, and I survived. I went to medical school. I am a developmental and behavioral pediatrician, and I wanted to extend a heartfelt thank you, Aunt Lucy. And Monday is her birthday. Before you go.
My name is Anita McMullen. I am Dana's older sister by 2 years. And
She made me do this.
I did. I remember what it was like to have my sister go through headaches that nobody could diagnose and figure out. And my mother holding my sister and rocking her in her arms. And within 48 hours, she was down Children's Hospital being diagnosed. And it was a scary time. And Dr. Rourke, thank you for your voice and your diagnosis and your mentorship to my sister through these years. I can't tell you how proud I am of my sister and who she has become, not only as a patient and as a parent and as a doctor, but the woman that she's become and the role modeling that you provided her. I want you all to look at my sister's necklace. This was given to her by Dr. Rourke.
It was Dr. Riggs, and Dr. Riggs gave it to Aunt Lucy, and Aunt Lucy gave it to me.
We wear it with pride. Thank you.
Friends, my name is Richard Herman. I'm the executive pastor at the Presbyterian Church, which means I work in a different kind of hospital, but one that Lucy is very significantly a part of. It was mentioned in passing by Derek that she's a woman of faith, and you all know that in very indirect ways. I know it in very direct ways. She's a woman who believes that there is one who's brought order to the world, and part of what we do, whether it's in my work in my hospital or yours, is to seek to follow and find that order and realize when things are out of that order that there should be a way to bring healing and hope. She is a woman of faith. She's also a woman of hope, one who believes that at that point there is something that can bring hope and life to others. We just heard a testimony to that effect, that where some might see that there is no hope, she believes there's a greater way. I personally know that she's also a woman of love, and that's not been necessarily said straight out, but it seems to run through here. There was a point when my wife and I were having some difficulties in our time. We've only known you. We've been here since 2002 when I came to the church. There was a point where we were having some difficulties that were not between us, but just in terms of life, and you provided great support. I also had the privilege of being able to perform the wedding with you and Boyce and with you and Harry, and experience how when love seems to wane at one point or be taken away, it returns, and you are one who recaptures that and captures that love. And the Apostle Paul, St. Paul puts it this way: these three things abide, faith, hope, and love. But the greatest of these, Lucy, is love. Thank you.
My name is Brian Harding, and as you might tell, I'm a limey. I'm from London. I had a very happy career of 25 years at Great Ormond Street in London, and the reason why I'm here is Lucy. That's the real reason why I came here, to work and learn from Lucy, and the last 7 years have been a joy. One of the things that I do, and as with my colleague Maria Rita Santi, we have lunch with Lucy most days of the week. At 11:30, the phone rings and I hear lunch. And I say, thank you very much, and off I rush. And when we have a half an hour of delicious discussion about tumors, about life, and about music, particularly the opera, which Lucy particularly enjoys, and as I do. And she knows how to keep the Metropolitan Opera on the right path. She writes stringent letters to them to tell them what they're doing wrong, which is sometimes true. And for that, I thank her. And for all the lovely times that I've had studying tumors with her, arguing and discussing. And one thing I want to say about Lucy, which probably has come out from all the other talks, all the other speeches, is that she has one very remarkable characteristic. If she asks a question, you have to answer it. There is no getting away from it. The way she asks a question, you cannot prevaricate. I wish she could be let loose on some of our British politicians. Thank you, Lucy. It's been wonderful. I wish it had gone on longer. Thank you so much.
I'm Maria Rita Santi. I'm the other neuropathologist, and although I speak very much sometimes, I'm very shy with a lot of these people. But Dr. Rorke, thank you very much for all you have done for me. Thanks to you, I'm here since 2008. It changed completely my life, even if it's much more difficult for me. I have to commute, but it has been a joy, and you will be always a sort of what my mother, that is very lovely, but always too much probably worry for me, has never been. So thank you very much. You are younger than her, and you are a very role model, and you will be always in my heart. Thank you.
Hello, my name is Joyce Peacock. I'm from Morristown, New Jersey, the town where Lucy resides. I speak not as part of the medical community, but as someone who loves, adores, and cherishes Lucy because of her outreach to so many of us that she has embraced like family. So from the bottom of all of our hearts, and in the many ways you've come alongside to nurture us, to provide that support when we need it most, we love you, Lucy.
Okay, Lucy, this was not part of your script for the evening, but we have something to present you with from Tiffany's, but it is not a diamond. So come on up, Lucy. I will hold this for you. Thank you. Thank you so much. I will take care of this for you.
Okay. Please sit down. I'm totally overwhelmed by the outpouring of love that you have all expressed to me this evening. I have had the most spectacular journey for the last 50 years with the family at the Children's Hospital of Philadelphia. I was invited to join the staff, which I did on January 1st, 1965, by Dr. Charles Kennedy, who was the chairman of pathology at that time. Children's Hospital had never had a pediatric neuropathologist, because in fact, pediatric neuropathology as a specialty did not really exist. I was led into the specialty in a very peculiar way. When I started my residency in pathology at Philadelphia General Hospital, I was sitting in the room with the other residents on the first day of residency. Dr. William Eric, who is the chairman of the department, walked into the room where we were all sitting. He looked around, and he walked over to my chair, and he said, You're the only girl here. Pediatrics is the province of ladies, and you have to do all the pediatric autopsies. Well, he'd never get away with that now. Of course, it's not politically correct. But in those days, we said, yes, sir, and did what we were told. I didn't know it at the time, but it was the most wonderful thing he could have done for me. It directed my attention in an area of pathology, which I followed when I decided to become a neuropathologist. And at Philadelphia General, Dr. Helena Riggs, who was a pioneer in medicine and who had gone to medical school back in the 20s, when finding a woman in medical school was really an extraordinary finding. And she was a fantastic role model to me. And I learned from her and from my professors that the responsibility that we have to the next generation is a very important one, and one that we should take seriously because we've been instructed and trusted to train the next generation of physicians who are going to care for our children, who are our future. When I started at Children's Hospital, the physical facilities were at 18th and Bainbridge. The pathology department occupied the second floor of a row house. And in order to reach the department, there was a set of rickety stairs, which in the winter time, when it was icy and snowy, was quite detrimental to your health because it was very easy to fall down and break a leg. One also had to be very careful in the department because two row houses had been put together. They weren't at the same level, so to go from one room to another, we had 2 steps up and 2 steps down. So it was rather harrowing. My office at that time consisted of 4 feet of counter space in one corner of the chief's office. There was simply enough room for a microscope in the center, the slides to the left, and a place to write on the right. So for 9 years, that was my office, until we moved to the facility here. But the most wonderful thing about being at the Children's Hospital was that I had the privilege of working with the most remarkable pioneers in pediatric medicine that were available in this country. We had the giants of pediatric medicine, C. Everett Koop, whose name is familiar to all of you, Bill Rashkind, who is a fantastic cardiologist who developed the balloon septostomy for children with cardiac disease, Stanley Plotkin, who is here tonight, I'm proud to say, one of the pioneers in development of vaccines, which have saved the lives of millions of children throughout the world. Paul Offit, of course, who we heard earlier, and who has been a dear friend, and I'm so proud to know him. Our wonderful John Duckett, who was taken from us much too early, who was one of the most incredible pediatric urologists that we've known. And we had the opportunity for developing a hospital staff to care for the children whose parents entrusted to our care. One of the most wonderful things about the Children's Hospital and my career there is that I had incredible freedom to develop my interests. I had, Dr. Yakovac was the chairman when I first went there, and then he was followed by Dr. Witzleben, one of whose daughters is here, and I'm very proud that she's here tonight, who allowed me to follow my interests, who never stood over me and said, you have to do this or you have to do that, but allowed me to follow the things that interested me, gave me the opportunity to develop in along the lines of curiosity and to accomplish what I was fortunate to accomplish. There are two things that have occupied much of my career for which I was not trained in medical school. One was administration. And as you heard tonight, I was cast into the role of chairman of the department, somewhat unwillingly, but I was raised by a mother who said, if somebody gives you a job to do, do the best you can. So I tried to follow her advice. And to handling the work that was needed to run the hospital when the day after I became president of the medical staff, the Board of Trustees fired the CEO. And so I, as the president of the medical staff, the COO, and the chairman of the board, had to run the hospital until Mr. Nodebart came to take over 18 months later. It's been a fantastic opportunity. But I think beyond those has been the privilege of teaching the next generation of scientists. And I am so proud of the students who have worked with me. Jeff Golden, of course, is one of my prize pupils, Alex Judkins, who spoke earlier. But I've had so many wonderful students, and it has been my privilege to learn from my students. One time I was with a student, we were discussing something with the microscope, and he made a statement, and he suddenly pulled back and he said, "Oh, but I shouldn't have said that because you don't agree with that." And I said, "You must never feel that way, because even though I'm a professor, I don't know everything, and I need to learn, and I can learn from you as a student. So don't be afraid to challenge your elders, because if you don't challenge your elders, we will never make any progress." I'll tell you a little story about Dr. Bruce. He told one about me, so I'm going to tell one about him. One day, he sent me a piece of tissue. He was operating on this child, and I looked at it, and I thought, this is a really terrible tumor. And then I looked a little bit more closely, and I thought, well, maybe it's not quite so bad at all. Maybe it's a kind of tumor that occurs in children who have a genetic disease, and they have a tendency to get tumors, but the tumors look terrible, but they really aren't. So I called the operating room back again, and I said, "Derek, does this patient have tuberous sclerosis?" Because that was the name of the disease. And he started to laugh. And he said, "I was wondering whether you would catch on to that." So even though we were dealing with very serious illnesses, and much of our work at the hospital with sick children is a grim and unhappy business. But we do our best, and through the cooperation and the interest and the opportunity to do research, we have the privilege of advancing knowledge and improving the lives of those who are entrusted to our care. I would like to say that none of this career would have been as successful as it has been without the wonderful and loving support of my family. And I would like to pay particular honor to my husband, Harry Knowles, whose inventions have touched the lives of every single one of you in this room, even though you don't know it. He's a genius who has over 400 patents, one of which is the handheld barcode reader. So all of you who go to the grocery store or the department store or any place have been a benefit of his genius. And I thank him. The gift that he has for you out in the little boxes in the lobby were his creation, and he has done me the honor to create this lovely gift for each one of you. So I hope if you don't already have it, you will take one, because each one of you has one with your name on it. So in summary, it's impossible to explain and thank you, each of you, for honoring me tonight and for the privilege that I've had of working with some of the most outstanding people, not only in medicine, but in my environment, and thank you for the love that you have expressed for me. I am deeply honored and humbled by your love and devotion. Thank you.
God bless you. Thank you. Thank you so much. Thank you.
I'd like to thank everyone for being here. In addition to the gift that Lucy mentioned, there are parking passes for everyone at the desk, and you may take the flowers that are the centerpiece. Thank you so much for being here.
Thank you.